Hey guys, this is Jennifer. It is May 24th, 2014. I am 115 weeks post-op gastric bypass. Real quick before I go into this great enormous update that I have, and it really is like a big update. I was just at 7-Eleven because I'm still addicted to these stupid Slurpees. This is actually the small. Usually I drink like 64 ounces of these, so for me to have this is pretty good. I am cutting back. At any rate, I was up at 7-Eleven, and the guy that was working there as the cashier, and the guy who was his friend apparently, as soon as I got up there, they started talking about this girl named Jessica who just lost a ton of weight, and yeah, it was my mistake for not hanging out with her anymore and it's just basically like, they're basically saying that now that she had lost all this weight, that she was worthy of dating, and that it was their bad for not hanging out with her anymore. And if there's a girl named out there that watches my videos named Jessica who lives near Southgate, Michigan, and who knows the guy at 7-Eleven and seen the other guy at Myers the other day, yeah, they think you're like hot enough to date now. But I wouldn't give either one the time of day since they didn't really care about you when you were bigger. But at any rate, I just thought that was funny and kind of ironic that that's the conversation that was going on. Well, I was there to buy a Slurpee. Anyway, my last video that I made got a lot of attention, a lot of positive attention, and I guess I hit a chord with a lot of people. And basically, I just want to make sure that you guys know that that video was not, I was not saying in that video that weight loss surgery doesn't work for people. I wasn't saying that at all. What I was trying to say was that you have to change your expectations of weight loss surgery, and you have to change your perception of what you think success is. Success, there's this stereotype that once you have weight loss surgery, you're going to be some skinny little model or some skinny buff dude, and you're not going to have any issues with food anymore, and you're not going to have to worry about it overeating anymore, and all that's a bunch of bullshit. And that's all I was trying to say, was that you still are going to have issues with food if you don't address them properly. And that even though this community is about support, that you really have to be careful that you don't fall into the comparison trap where you're constantly comparing yourself to other people, and because of your comparisons you start to feel less than. And that was really the whole point of my videos. I just didn't want people to feel that way. So that was why I made that video. But since I made that video, I kind of made the decision to approach all my issues, which I'm very open about, to kind of approach my issues from a bilateral approach. So on the one hand, I decided I'm going to find and start seeing a therapist that works with food addiction and eating disorders. On the other hand, I'm going to have revision surgery. And so I thought about it, and I decided I was going to have the lat band. So it'd be called a band over bypass. And I ended up finding a therapist that used to work at a eating disorder center, and now she practices on her own. I've been seeing her for 3 weeks now. This coming week will be my third visit, and wow. I've been in therapy a lot in my life, and this woman is amazing. So it's not just, it's made a big difference that she specializes in eating disorders. So I really highly recommend that if you have food issues, and who doesn't, if you have weight loss surgery, you pretty much have food issues, most of us anyway. It's really beneficial to try and find someone in your area who specializes in eating disorders. If they specialize in eating disorders, then the food addiction is kind of encompassed in all that. And then I also, at the same time, started sending paperwork in from different doctors and blah, 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 blah. Long story short, I ended up getting insurance approval to have the band over bypass. The good thing about the band over bypass is that the band over bypass cannot slip. That's an issue that a lot of people who have just the band complain about, is it's slipping. When you have the bypass, it does not slip. In order to get the band, you have to obviously get an insurance approval. You also have to have an endoscope done by your surgeon to kind of make sure that everything is intact, to make sure that your stomach, and to make sure everything's intact so that it can fit the band around it. And how it works is they When you actually go in for surgery, they put the way my surgeon does it anyway, is he puts the band on, but he does not fill it up. My cats are loving the window. He puts the band on, but he doesn't fill it up. He lets your body heal from surgery, lets your body adjust to this being in your body, and then in the next 4 to 6 weeks, he starts slowly filling it up so that you get the restriction, but that you don't feel too restricted. And that's just the way he does it. You do have to keep up with your doctor's appointments. You do have to go like every 6 weeks. You can't just magically fall off the face of the earth after 2 or 3, 4 years, because it can still corrode. It's part of the band. It's just part of it. But I'm really good with keeping up with my doctor's appointments. So I thought it would be a good fit for me because of, hold on a second, my oven's going off. Hold on. Okay, sorry. Protein first. I was reheating some chicken from yesterday. And I thought it was a good option for me because really what I want back is the restriction. So I thought it would be a good option for me. They did the endoscope yesterday, and I actually have pictures. Don't they're not squeamish pictures, so don't like freak out and think I'm going to show you like really gross stuff because it's not really squeamish. But long story short, I can't have the band over bypass anymore. Essentially, because I didn't have much restriction, we were kind of convinced that my stomach pouch had stretched. And if that was the case, then the band would be a good option because then it, tightens up your stomach and you're fine. Turns out that my stomach pouch is fine. It's the exact same size it was the day of surgery. My stoma, however, which is the new connection between your stomach and your new intestines, it's where your food goes from your stomach into your new intestines. That is twice as big as it should be. They said normally it should be like a little bit bigger than an M&M, and mine is easily twice that size. So let me just show you. I don't think there's any horribly bad information on here. I'll just kind of cover up my last name or whatever, but you see, I don't know if you can see. Oh man, this sucks. Okay. Yeah, that's my stoma. So it's supposed to be, and that's an actual size. So it's supposed to be like I said, a little bit bigger than an M&M, and you see that that is way, way bigger than an M&M. So that's why I have no restriction. It's not all in my head. It's really like I've not had surgery. So I can eat small amounts, and I get full quickly, but it passes through my body very quickly, and then I'm hungry again. So at this point, my options are either no surgery at all, or to have the gastric bypass revision, which is where he will go in and he will tighten up the stoma to make it the same size. The way that this typically happens is there's 2 ways. Either the surgeon doesn't make it, or makes it too big to begin with. Because what your surgeon's doing when he creates the stoma is he's basically guessing based off his past experiences and based off how bad he thinks the scar tissue is going to be once you start healing. They can make mistakes. That big of a mistake? No. And the other way that it happens is your portion sizes are just too big for too long and it stretches it out. So my surgeon says it's probably like a 20-80 split. Like he will take 20% of the responsibility that maybe he made it a little bigger than he should have. But 80% of it is because I've been very honest with him about how I eat and the bad habits that I have. And he says you've probably just stretched it out. I did start crying when I woke up and I got the picture and I had everything explained to me because I felt very frustrated and embarrassed that I had done this to myself. And they quickly said, like, this happens to a lot of people. And the nurse said, I hate to tell you this, and I'm telling you this in confidence because I feel like I understand that you feel really bad, but they don't give post-op patients enough care, medical care afterwards. And you wouldn't believe how many people we come in here with stretched pouches or stretched stomas because they've never been taught how to change their eating and they can't just change it overnight after they've had surgery. So that kind of coincides with what I've thought all the whole time. So now I've called the insurance department. It being the holiday weekend, I can't get a hold of anybody until Tuesday anyway. But I left a message for the insurance coordinator to basically scrap the bypass or scrap the lat band, the band over bypass. That even though I got approved for it, I'm not doing it because the doctor said he could still do it, but it's not going to make any difference because my stomach is small, and the lack of restriction is not due to my stomach, which is where the band would go. It's due to the stoma, and the band won't do anything about the stoma. So he wants to do the bypass revision, where he makes the stoma small again, and it will instantly give me that restriction back. And then I just have to follow proper portion sizes and follow the rules. So I'm hoping in the message I left for the insurance coordinator, I let her know that. So my surgeon says he doesn't think my insurance will cover it. The research that I'm doing, God, I hope they do. And Berg's Clinics has been amazing, absolutely amazing. And if anybody can somehow convince my insurance company to do it, it would be there. They've been great. The only thing I didn't like was that yesterday they told me my endoscope was at 6 a.m. So we got there at 6 a.m., meaning we had to leave here at 5. And we get there and they do my blood work, and then they're like, oh, you're not scheduled to 10:30. And because we had already checked in and I had already done my blood work, I couldn't leave. So it was a long, long wait to get my endoscope done, and we were very, very tired. And then I couldn't sleep when I got home because I had my niece until 11:30. And I couldn't drive all day. So it was a rough day. But it's all done now. Can't do the band over bypass. Hoping I can do the revision of the bypass revision to, make my stoma smaller. Other than that, I was just really sick like a week ago. Had very, very, very bad stomach pain. Was very nauseous. Could barely eat. I'm always over my calories. I'm always about 2,000, 2,500 calories a day, and I couldn't even eat 800. It was unbearable. Very, very, very nauseous. And I don't know what it was. It lasted for about 4 days. And even now, I'm still not eating as much food as I was. And I still get nauseous once in a while. But I'm not pregnant, and I don't have the flu, and I never had the flu. And I'm just popping Gas X like crazy. And I ended up having to take Imodium multi-symptom for about 3 days just so I could leave my house. I had to call off work and everything because it was so unbearable. But it's crazy. So there you go. I know this all probably sounds like too TMI or whatever the case may be, but it's real and it happens, and it's just part of surgery. So I will let you guys know what happens from there. Thank you so much for watching. I'm going to go eat my chicken now. And I will talk to you guys soon. Have a good week. Bye.